Eczema is a common inflammatory skin disease affecting around 1 in 5 children and 1 in 10 adults. It's also known as dermatitis or atopic eczema. The most important symptom of eczema is itch. It can be better thought of as the itch that rashes, as opposed to the rash that itches. Eczema can affect sufferers very differently, from mild itch and skin irritations to really severe debilitating skin inflammation, infection, sleep deprivation, stress, and serious mental health effects. It's a complex condition caused by a complex interplay between environment and genetics, and it's related to other atopic conditions such as asthma, hay fever, and even allergies. Our skin is like a brick wall, with the skin cells that make up the skin being the bricks and the natural fats and oils that they produce being the mortar that effectively keeps everything sealed together, creating a barrier that keeps moisture in and bugs and irritants from the outside world out. In sufferers with eczema, their skin doesn't produce as much oil or fats or the moisturizing mortar. This results in skin that is more prone to drying out, becoming irritated and inflamed, and developing infection and allergic reaction. In eczema sufferers, a variety of seemingly harmless activities can make skin flare. Something as innocuous and harmless as using alcohol gels, the wrong soaps, bubble bath soaps, washing up liquids, and even just plain water and can strip away moisturizing oils from the skin, resulting in the skin breaking down, becoming cracked, irritated, and inflamed. When the barrier function of the skin is compromised, bacteria, fungi, and viruses like cold sore viruses can infect the sufferer more easily, resulting in infections. Irritant substances can also penetrate more deeply and cause reactions. The treatment of eczema really needs to be tailored to the patient, the severity of disease, age, and where the skin is affected. There are 3 main pillars that I use to treat eczema. One is to replace that barrier function, or replace the mortar of the skin that is lost, through the use of moisturizers, and also minimizing or modifying activities that can strip away the natural moisturizers, or the mortar in that analogy, in the skin. The second is to control inflammation. And this can be through a variety of ways, including the careful use of anti-inflammatory agents such as topical steroids or steroid-sparing agents. The third is to treat, but importantly not to overtreat, any skin infections. There is no permanent cure for eczema, but we have many ways to manage and control the symptoms of itchy, dry skin that results from the disease.